Welcome everybody to week 4 of the Sweet Success program. Today's topic is Step Up Your Foot Care. We're going to talk about foot care, how to take care of your feet, complications. We are going to talk about amputations because that's very common with diabetes. So I want to give you all the tools that you can have to prevent that from happening down the road. Okay, so the first thing I'm going to start with, I wish I had done this from the very beginning of our program. I really like this slide. It's something that I want to pound into everybody's head, that you need to know your ABCs with diabetes. The A is your A1C, and I've given the ranges there for prediabetes and diabetes. B is for blood pressure, and that's less than 120/80, and then your cholesterol reading. All of these things affect your blood flow, your blood sugar, and you kind of need to know what they are to be able to manage your diabetes as you go forward down the road. Okay, so we're going to talk about diabetes and amputations. I did not put any gory pictures in here, so that's about the most foot picture you're going to get. So diabetes is the #1 cause of non-traumatic loss of the toe, foot, or leg. This is huge to think about how many people lose part of their foot or their legs or their ankles, whatever, just simply due to diabetes. And we have to stay on top of our diabetes. We have to stay on top of our blood sugars. And almost half of these amputations are preventable. So we're going to get talking more about how to take care of our feet, what to look for, to be aware, increase awareness just about prevention itself. I thought this was a really interesting statistic. I don't have a lot of them in here, but I did throw this one in there as well. So the mortality rate after an amputation that first year is 13 to 40%. That is enormous, absolutely enormous. And then within 3 years, it goes from 35 to 65%. And then in 5 years, 39 to 80%. This is worse than most malignancies and cancers. So the thought of being able to manage a diabetic wound on your foot and being able to increase your life expectancy is just huge, absolutely huge. So we're going to talk a little bit about what contributes to these amputations when we have diabetes. Not everybody's going to have an amputation. We are going to do our best to give you all the information to be able to manage your diabetes and to prevent wounds and complications and these kind of horrible things. So contributing factors, #1 is poor glucose control. And you're probably thinking, okay, what's that got to do with my feet, right? So when we talk about glucose control, when your glucose numbers are really high, say you're running in the 3, 4, and 500s when you do your finger stick, that means that your blood is very thick and sticky. And so when you think about, for example, if you have you're making some hot tea on the stove, so you put your tea bag in your water and you pour that out and it's just really thin, right? So if we add some sugar to that, it becomes thicker. If you add a cup of sugar, it becomes really thick. That same concept we want to use when we think about diabetes and what our blood is like when our blood sugar is high. So our blood delivers nutrition to all parts of our body, including areas that we have sores and wounds. It carries nutrition to heal the wounds that we have. So if you're having poor circulation to that area, that means you're going to have impaired delivery of nutrition to heal that wound. Blood flow also takes away all the debris as that wound is breaking down and healing. And so blood flow is so very important to many different things in our body, but when we have wounds or sores on our feet, or even if we don't have sores yet, we want good circulation to make sure all the cells are healthy down there. Diabetes also can lead to loss of feeling in your feet. It can lead to pain, numbness, tingling, and that's not specific to the feet, but since we're talking about feet, that's why I'm kind of focused on that today. You can also lose sensation in your hands, the cheeks of your face, and your thighs. And so that's something to think about. When you don't have feeling in your feet, you're not necessarily aware of it. You may be walking around, some people end up with blisters or sores or cuts that they don't even know about until they pull their sock off one day and they have a draining wound. So that wound has developed, gotten worse, got infected, and is draining, and it sticks to your sock. And that's how some people discover that they have wounds on their feet. So it's very important. We're going to talk about looking at our feet every day as well and making sure that we don't have anything going on so we can catch it really early and get it healed quickly. So circulation can also be impaired. Again, we have the thick, sticky blood. We also, how cholesterol plays a role in this is people with diabetes, cholesterol numbers tend to be up. When your cholesterol is elevated, and your blood sugar is up, it can cause damage to the vessels that deliver the blood, that has the blood running through it to deliver to all parts of the body. So you can have cholesterol buildup on the inside of the wall called plaque, and that will also decrease circulation to certain areas. So we want to make sure, again, we know our A1C, we know what we're doing with our blood sugar, we want to know our blood pressure. High blood pressure can also damage the vessels. And then circulation, we also want to make sure that we've got good circulation. We know what our cholesterols are and try to control those numbers as well. Pressure is another contributing factor. So, and people get pressure ulcers, not just people with diabetes, everybody can get them. Anytime they have pressure on skin, that stays there for a long period of time. So when we're looking at our feet, we're going to look at areas that would most likely have pressure on them. And that will be the areas where you have bony prominences. It may be the heel, it may be your the inside of your foot below your big toe. Sometimes the bones in the feet become a little deformed with diabetes and start to protrude in areas where they didn't in the past. So pressure is something that can also cause diabetes ulcers and eventually lead to amputations. So there's lots of factors that contribute to why people get amputations when they have diabetes. Charcot foot is another serious but rare complication, but I did want to throw that out there. People with peripheral neuropathy, and that's where they lose sensation in their feet, don't feel it, may have pain, may have only tingling or numbness. This affects the bones and joints and the soft tissues of the foot and ankle. And so all of those bones begin to weaken and they can actually break. And then you can have dislocation of different areas in the foot where the joints are. So if you think about not having feeling and sensation down there, these things could be happening and we could be completely unaware of it. And then one day, our feet start swelling, they get really red, you're looking at it and you're like, wow, my foot looks really different. I don't remember it used to be that way. So this can also, if you do have sensation, it can be a very painful complication. So again, part of how we're going to prevent these complications, control our blood sugar, know what our cholesterol is, control our blood pressure, and assess our feet every day. So here we kind of summed it up again. Controlling your glucose, we know how to do that. We're learning as we go. We want to be able to manage our dietary, our meals very well. We want to have balanced meals. We want to have appropriate calories. We want to exercise. That helps keeps the blood sugar down and keeps the blood flowing. We want to take our medications as recommended by the physician. That helps us control our blood sugar maybe, and also may help control blood pressure and your cholesterol, among other things. And we want to have routine doctor visits. So many people, they end up not going to the doctor because they're not really having complications or sickness. But sometimes we need to still go just to make sure we know what our A1C is doing. And sometimes we can recognize problems early and get a jump on it as well. So that was glucose control. We want to inspect our feet daily. We want to do preventative care, protect our feet, and seek care for non-healing wounds. So we're going to go into this a little closer. We talked about the glucose. I think my slides got mixed up there. So we're moving on to daily foot assessment. So even if we have prediabetes, if we have diabetes, even if we don't, it's a good idea to look at our feet. We want to use a mirror if we have to. Some people can't bend down and get to the bottom of their feet and see what's going on underneath. You can actually set a mirror on the floor and move your foot around and look at it from the chair. If you can get your foot up there, you can visually inspect it, but mirrors are really handy, particularly as we age, or if we're not very mobile, that can be a real good way to assess the foot. If you can't see it and you can't manage that mirror very well, you can get a partner or a friend to look at the bottom of your feet. You want to look at the bottom of the feet, the sides of the feet, the heels, all parts of the foot, in between the toes as well. We are looking for areas that are red. So when you find a red area, you want to push on it with your thumb, and if it turns white and doesn't return to normal skin color, you probably have an issue with pressure. We want the blood to fill up back really quickly. That way we know we've got some circulation going on there. We're also looking for dry, scaly, or cracking skin. And cracking is real common along the back of the heel and the bottom of the heel. And a simple crack in the heel can lead to an infection and amputation within just, the wounds can progress very rapidly within just a few days to a week or 2 weeks. So it's really important to pay attention every single day. We're looking for calluses, broken skin, and sores, and also ingrown toenails. That's everybody's favorite topic, I know, right? So we have probably managed ingrown toenails. Somebody in this group has probably managed it all by themselves successfully. But now that diabetes is a concern, we want to make extra special care that we're taking care not to damage any skin around that. And my recommendation, you should see a physician to manage those ingrown toenails. Infections can happen so quickly, even if your glucose is perfectly controlled with medication and diet and exercise. A simple infection can shoot that blood sugar up really high, really fast. And if you get that infected, so diabetes absolutely loves infections. Anytime you have any infection at all, you're probably going to see your blood sugar go up. So in this case, if you have an ingrown toenail, you've been messing around with it, it does become infected. Your blood sugar is going to shoot up. And then when that elevates, it's further impairing that area to heal, because now your blood is again thick and sticky. So it's having trouble delivering nutrition to that area. So it's kind of funny how things kind of roll together with diabetes. Okay, our next slide here. So we're talking just briefly about the structure of the feet. With diabetes, you can get some abnormal structures. We talked about the Charcot foot. The arch can also fall. You can have deformed bones, and your foot can begin to have like a claw-like appearance. So we just want to make sure that we're aware. And if we're looking at our feet every day, noticing that if anything is different or abnormal, we want to let our docs know that when we do our routine visits. However, if it's something that symptoms of Charcot foot, you might want to go ahead and call the doctor and just get an appointment. So we talked a little bit about peripheral neuropathy. That is actually nerve damage from diabetes. And the symptoms include numbness, tingling, pain, and these are things we do want to report to the doctor. If you have pain, most likely it's going to worsen and you will end up eventually at the doctor. But the sooner you get on top of that, the better off you will be. When I've done diabetes education in the past, I've ran into people whose pain, nerve pain has become so bad that they simply can't stand long enough to cook a meal. So we want to make sure, again, that we're trying to manage diabetes and take control of it before it gets to these kind of serious complications. So now we're going to talk a little bit about preventative care. How do we keep our feet healthy? How do we make sure we're doing the right things managing foot care? So for people with type 1 diabetes, they recommend annual foot exams 5 years after diagnosis. Type 2 diabetes, they want you to see a doctor for annual foot exams at least once a year. When you're with your doctor, make a foot plan. When do I need to come back? Do I need to see a podiatrist, which is a foot specialist? Sometimes your primary doctors will be happy to manage your feet. Maybe if you have real complicated nails, you might get referred to the podiatrist though. Some people with diabetes are eligible for special shoes, diabetic shoes. Medicare does cover those, new once a year, and inserts up to 3 times a year. You do have to meet specific qualifications. So having diabetes or prediabetes doesn't necessarily mean that you automatically qualify for shoes. But I would encourage you to ask your physicians about it, particularly if you do have nails that are really thick that maybe rub against your shoe, or you have calluses, or your foot's kind of bony and abnormal. We really recommend that you get that checked out and see if you qualify for those diabetic shoes. And they used to be really ugly shoes, I got to admit. Now they are absolutely, they have some really nice looking shoes. I am going to rename myself, you guys. I just noticed that it's got Jill's name in there. So I apologize for that. My name is Linda, so give me just a minute here and see if I can get my name up there correctly. There we go. Sorry about that. All right, so we're going to get back to the preventative care. Like I said, check out those shoes. They've got some really nice shoes out there. They're very pretty. And if you can get your insurance or Medicare to cover it, that makes it just all the more better. So before you leave your doctor, whether it's a primary doctor or a podiatrist, you want to make sure that you schedule a follow-up appointment. Those follow-up appointments can slip off the radar. You forget to call, and suddenly you're 2 years into it and you haven't had your foot looked at, for a couple years. If you do see a specialist, the podiatrist, please have them send the records to your primary doctor. That way everybody's on the same page when it comes to evaluating and looking at your feet. Protect your feet. I know nobody wants to hear this because we all love to go barefoot even in the house. However, they do recommend you wear your shoes at all times. If your house, especially if you have a cluttered house, or you have a lot of toys, or you have your grandchildren there, or you just have a lot of stuff laying around that you might step on, I'd really recommend clearing the pathways at least, but they do recommend you don't go barefoot anywhere, indoors or out. You should always wear well-fitting shoes. Again, check on the diabetic shoes. And then report all non-healing wounds to your physician. We're going to talk a little bit about wounds here in a few minutes as we move along. And then we want to do appropriate nail care and appropriate skin care. Okay, so again, we're going to review just a little bit about things that I've already said once, but we're talking about nail care. You want to see your podiatrist 1 time a year. You want your physician to inspect it 1 time a year unless you're seeing the podiatrist. We do cut our nails straight across. I know nobody likes to hear that. It's not super pretty and doesn't look super manicured, but it is important to try to prevent hangnails and cutting too far into the quick of your toenail. So cut nails straight across. You can file the nails very gently on the edges so you don't catch that rough spot on your socks when you're putting your socks on. And please never work on your ingrown toenails by yourself. I, again, highly recommend if you have ingrown toenails that you see a physician about it if you have diabetes. Like I said, those can get out of hand really fast. So we want to wash and dry our feet every single day, and we want to, again, inspect them daily. If you're washing and drying them every day, you can inspect it at that time. If not, you can do it when you put your socks on or when you take your socks off. But I would make it really routine, something that you do every single day so that you get in the habit and don't miss it. We're watching for red areas. Those are the pressure areas we talked about earlier. We also want to make sure we're drying very well in between the toes. So anywhere that there's moisture sitting for any length of time, that can cause skin breakdown and an open wound. So that is one of the prevention things we want to do. They also recommend that you apply lanolin-based lotion to your heel and foot if they're dry and cracked. We want to make sure we keep those soft and subtle so they don't get the cracks in them and end up with wounds. Do not put lotion between the toes. Same concept as it being moist after taking a bath or a shower. We want to make sure there's no wetness in there. That skin will break down if it's kept constantly wet. So we are going to talk a little bit about wound care. If you do see that you have an open wound or a sore or a crack on your foot or your around your toes or anywhere on your foot, you do want to cleanse it gently with soap and water and apply a Band-Aid. We want you to contact the doctor if the wound does not show improvement in 1 to 2 days, or if it gets worse. Make sure your glucose is controlled as well. Again, you might have trouble healing a wound just simply because your blood sugar is out of control. See a specialist if your doctor recommends it. Don't put that off. Just go get it done. Get that wound taken care of quickly. Never try to manage non-healing wounds. It is probably a losing battle. I met a gentleman at my last position that worked at a university. He had bought some new shoes and he was a security guard. So he walked from area to area. That was kind of his job all day. Then suddenly he found out he had a blister on his foot. That blister turned into a stage 3 wound, which is a deep wound. It was infected. He had 2 infections in the time it took to heal this wound, but the wound went from a blister to a very red infected sore within about 5 days. This gentleman also had diabetes and did not know it. So to start with, he had new shoes. They were rubbing. He wasn't looking at his feet until he found that blister one day. It was draining, started draining. He went to a doctor. The doctor did his A1C. His A1C was 11.2, I believe. So it was sky high. That means his blood sugar had been up for some time. Over the last 90 days, it had been elevated. He had to go to the wound care clinic. He went 3 times a week for about, let's see, over 4 months. In that time frame, he had 2 infections that had to be treated. The wound had to be debrided or cleaned out because it was so infected. They had to remove the bad tissue so that new tissue could grow. And in that time frame, he also had a lot of trouble controlling that blood sugar simply because he had an infection. He had pain. It was stressful. They casted him in a walking cast twice. And so he had some really severe complications. Number one, he wasn't aware he had diabetes, which is not really that uncommon anymore. Because when you first get diabetes, you often don't have a lot of symptoms. Your blood sugar often goes up and you feel just fine. I've had people come to me with blood sugars in the 400s and 500s, and they say they have no symptoms at all. However, we notice that once we do get that blood sugar under control, they will say things like, I never knew I felt that bad. So these kind of issues can kind of sneak up on you. Diabetes can, and you may not know that you really have problems or symptoms until you actually get checked. So we are going to clean our wounds with soap and water. We are going to contact the doctor if they don't get better. We're not going to mess around with it. We're just going to go and take care of it. Our next slide is just today. This is the summary of today. These are the takeaways that I hope you guys take with you today. To know your ABCs, your A1C, we want it to be controlled. We want your blood pressure controlled, and to know your cholesterol. Again, control your glucose. We want you to inspect your feet daily. We don't care what time of day you do it, just do it daily. You want to have a routine inspection by your doctor, and you want to see a doctor for ingrown toenails. That got its own little blurb there because that is really one of the most common things that lead people to have diabetes or open infection wounds in their foot. And cut your nails straight across and file those edges. And I thought I would end the program with some happy feet. I don't know how baby feet can't make people happy because they're so cute and fat and fluffy there. So I did want to show a pretty picture today, and I thought that one was appropriate for our foot care program today. How about you guys? Do you have any questions for me? If you do, you can chat them there for me. And I'll be happy to answer any questions. My mom happens to be a nurse as well, and she would die if she had to watch this. Luckily, I didn't have a lot of pictures, but my mom is a nurse and she thinks that feet are absolutely disgusting. So I personally don't mind them. I like to make sure they're taken care of. Like I said, I'm happy to do the free diabetic foot exam. We can see if you guys have lost any sensation. You just need to contact me so we can set up a time, a date and a time. I'm going to try to stop that share and see if I can get my, there we go. That looks better. Okay, guys, I don't see any questions. You guys have my email. If you do have questions you think of later, feel free to email me. Also, please email me. I'd love to do the foot exam. It's completely painless. You do have to take your socks and shoes off, though, in order for me to be able to do that foot assessment. So I do have a comment here. I was going to try to look at real quick. One of the participants says they have no questions, but cannot stress how important this is. And I'm with you. Beth actually said that. Beth, I'm absolutely with you. As a diabetes educator, I cannot tell you the number of times I have seen a wound go from a tiny blister to a very deep wound requiring surgical debridement and sometimes amputations. It happens so very fast. Like I said, when your blood sugar is that thick and sticky, just think about you're getting no nutrition down there at all. So that wound is not going to heal on its own. So thank you, Beth, for that comment. I appreciate it. Okay. All right, you guys. Next week, the program will be on exercise and diabetes. Our presenter will be Shanna Watt. I will not be here next week, and Shanna's very adept at running these. She's like the professional, so she will get on here and do the presentation. If you guys have questions, you guys can email me questions about exercise, and I will try to get that exercise flyer out to you all. I know somebody had asked for it, and I apologize I haven't gotten to it, but I will. We are also editing these recordings, so eventually you guys will see the recordings coming through your email as well. Thank you guys so much. I appreciate you all being here, and we'll look forward to seeing you in the future. Thank you. Bye.